afternoon, everyone. I'm Vicki Janowski, editor of the Greater Wilmington Business Journal, and I want to welcome you to the reboot of our Wilmington BizTalk show that we do every week now on health and business issues affecting the Cape Fear region. It's hard to believe that it's been almost a year since the coronavirus impacted our area and upended everything. That's when we started this weekly and daily show through the Business Journal so that we could talk with health experts and business experts in the area and really get into all these fast changing conditions and things that were happening as we all grappled with what was happening with COVID-19. Throughout the year, we continued to expand that program and talk about other business and economic development issues of our area and invite different guests on each week. We took a little bit of a break around the holidays and we're back now with an even larger program and great ideas for speakers coming up for you in the weeks to come. We've also added on a podcast, so if you're like me and prefer to listen to this while doing errands around the house, you're welcome to subscribe to that on our Apple Podcasts and Spotify channels, and you'll be able to listen to the weekly shows at your own convenience. But today we are going back to health issues and COVID-19 and talking about an area that is also rapidly changing right now, and that's the vaccine programs and how that's rolling out in our area and across the nation. Today, we have a panel of experts that can fill us in on what the latest is and what to expect coming up next. We have from the health departments, David Howard, who's interim health director for New Hanover County, and Cris Harrelson, who's the health director for Brunswick County. On the health provider side, we have Jeff James, CEO of Wilmington Health, joining us, and Claire Corbett, who's director of clinical excellence for New Hanover Regional Medical Center. So if you tuned into these live streams last year, you'll know that I will keep an eye on the questions on the feed, and you're welcome to post those, and I will toss those over to our panelists for the next 20-30 minutes that we have them here to answer our questions, both about how the process is going and also questions that you might have on the medical end for the vaccines themselves. So not to waste any more time and jump right in, Cris and David, if you could just kind of give us an idea from the health department standpoint where things are right now, both in terms of who is getting vaccinated and how the demand is keeping up with the supplies that you guys are getting from the state.
Cris, I'll go first if you like. In general, both the Group 1 and Group 2 in the latest iteration of the state's prioritization are eligible to be vaccinated. So Group 1 is all of healthcare workforce. And Group 2 is 65 and over population, regardless of any health conditions. Those are relatively large numbers. In New Hanover County alone, we're looking at least 37 to 40,000 people in those two groups. I say both groups because we started with the first group, healthcare staff in the hospital, and then expanded from there in terms of healthcare staff. But we continue to see them as they present themselves for vaccination, as well as the 65 and over group. In terms of supply of the vaccine, we're seeing a relatively low supply at present. Hopefully we'll see that supply nationwide continue to grow. And as that grows, the array of providers will grow as well in terms of where people might be able to access the vaccine. Wilmington Health and New Hanover have been fantastic partnerships. The Federal Qualified Health Center is also receiving vaccine directly as well. In terms of our operations, I think collectively across all providers for New Hanover County, we are rapidly approaching, if we haven't yet reached that, a number of first dose vaccinations right around 10% of our population. I think that's a great accomplishment in relatively a few short weeks, with 2 of those weeks occurring over holidays. If you will remember, we received vaccine mid and late December and right across Christmas and New Year's holidays. So it's going well. We know everyone would like to be vaccinated as soon as possible, and which is a good thing. The demand is a good problem to have. We were actually worried a few months ago about a heavy amount of hesitancy. So it's going well overall.
And Cris, what are you guys seeing in Brunswick County in terms of demand and rollout?
We have a unique problem in Brunswick in that about a third of our population is age 65 and over. That's about 46,000 people. for a county that's total population is 143,000. So our demand far outpaces the supply of vaccines that we have currently. But I agree with David. Things have been going well in Brunswick. We have partnered with Navant Hospital and Dozier Memorial Hospital to put on a joint drive-up vaccination event at Odell Williamson Auditorium. It's there Monday through Friday every week at Brunswick Community College. And we've been seeing, we're scheduling appointments, so it's not a first come, first serve basis type event. So we schedule appointments, so everyone that goes there gets a vaccine, and we've been seeing a large demand for the vaccines that we have.
And on that line of demand, Claire, let me turn it over for New Hanover real quick, just because I see the notifications when appointments open up for available vaccines. And then I see the notifications come across within minutes later saying that all the supplies are gone. So I'm sure all four of you guys have seen that experience in recent weeks. But can you share a little bit about what the hospital's role has been in rolling out some of the vaccines? And then also, Jeff, if you could jump in there as well to say what Wilmington Health's role has been.
Yeah, thanks, Vicki. I'm Claire Corbett, first of all, and I've had the privilege and responsibility to be part of our vaccine program here out of New Hanover Regional Medical Center. And we started in mid-December, as David mentioned. We also were worried about there being a lot of hesitancy in the beginning, and we really have seen the opposite, which is a great problem, and that many want to be vaccinated. The hard part is really around supply and how much supply we can get every week. And, we're committed to, over the next many months, vaccinating everybody who's willing and wants to throughout the community. The hard part is how much vaccine we can get every week. And we try to transfer it as quickly as we can from when we receive it out into our community.
So first of all, I want to recognize David and his team. Really appreciate the partnership. It's been tremendous. I think there's other things that we can do within the community to, since there's such a limited number of organizations vaccinating, to really come together and put on a community effort and hopefully take some of the volatility out of it. But so far, I really appreciate the partnership with the county. We are also, as Claire mentioned, I'm very proud to be part of the community solution here and with Wilmington Health. I think Wilmington Health was the first non-hospital, non-health department provider in the state to be given the privilege of delivering some of the vaccines. So I'm pleased with that. As has been mentioned, the biggest challenge is a steady, constant flow of vaccines, and there's definitely not enough. But one of the things that we've done from the very beginning is we said that we're going to be part of the community solution and started vaccinating not just our own patients, but the community's patients as well. Something that David and I talked about early on, and something that we're committed to. I think roughly about 25% of our patients that we vaccinated are not Wilmington Health patients, and we want to do more of that. We've had tremendous outreach in the Spanish-speaking population because they're affected pretty dramatically by this, and really want to give a shout out to our team that's working behind the scenes to make this happen.
So I know with a vaccine that came to emergency use, but basically came to the public in this warp speed and as quick as it did, there was no illusions, I think, going in that once it rolled out, it was going to take a while and get the kinks worked out, especially for something just kind of unprecedented like we're doing. But there have been questions about, when we talk about allocations and how you guys are distributing them, in terms of just that logistics chain and how it's getting from the feds to the states to the individual counties. Cris, I know over in Brunswick County, the elected officials there, and also in Pender County as well, has raised some alarm to the state about whether they're being equitably distributed around North Carolina. Can you give us any insight into where that discussion's come from, or what is it the other counties are talking about, how it might be changed in the future?
Yes, here in Brunswick, as I mentioned before, we have a tremendously large senior population. And our elected officials were very concerned that our vaccines were not matching the demand of that particular population. So they did send a couple of letters to the governor asking for additional vaccine allocations to compensate for this demographic in our population.
And then the next step, I wanted to talk a little about if you have heard anything more from the state in terms of the plan for Walgreens to actually start administering vaccine doses next week in North Carolina, whether any of those locations will be local and how that's going to work. Will you guys coordinate that through the health departments at all?
That is actually a federal contract program with Walgreens. There are actually several national pharmacy chains participating in that program. In North Carolina specifically, Walgreens is the only one listed on their website and the federal website as being participating in that, but the other pharmacy chains nationwide are participating in that. So that's a program where the federal CDC is delivering vaccine directly to their network and their logistical network to distribute to their chains to make it available to the public. But on that point, each location within any given state is to follow the prioritization of that given state that they're located in. So they should be following the same prioritization that ourselves and Jeff and Claire and everyone are following along the same lines. So that's a federal level program. To your question, we won't receive any of that vaccine and distribute to Walgreens or any other pharmacy. It'll go straight to them. And in fact, the Pfizer is getting shipped straight from Pfizer. So the allocations are really just numbers provided to the state, and then the state every week allocates that to counties. And to Chris's point, they've had to do some adjusting, allocating. Originally, I asked, for instance, about how they were allocating, and they said they're looking at population density, transmission rates, case rates, percent positive rates, and other factors to try to make the biggest impact as early as possible. And that's also partly why they dedicated in one given week a lot to Mecklenburg to try to impact the level of cases and transmission in a major metropolitan area like that. So that's how that particular system is working. And then the Moderna is actually getting shipped by McKesson, which is a national distributor. So none of that physically is going to any state warehouse anywhere. It's getting shipped directly to the recipients.
And David, you mentioned that they'll be going through the same priority levels that the providers and you guys as health departments have already been doing with your appointments. And we did have a question come in from a reader, and something I was wondering about as well was, did anyone have any information about the latest for when the next group of eligible residents might be included? Particularly, I know the frontline workers are going to be coming up next, which includes teachers, which has become a point of discussion in terms of schools reopening, and the school board has been discussing that, police officers, grocery store workers. So a very large group that entails. And so I know that opening it up to the next level also brings in questions about that supplies that we're talking about. But if anyone's heard any updates on that and wants to share.
So
I don't think we know yet.
The when, we don't know. We know the what, but we don't know the when. As Cris mentioned, and we mentioned, and we're all in the same boat really with the numbers to serve based on supply and demand. It may be several weeks before we really feel like we have offered and provided vaccination to everyone 65 and over. Also, another factor is we're a regional hub for many things, right? Same as a Cumberland or a Great Pitt or Wake. So we can't exclude a resident of another county to receive a first dose of vaccine. So naturally, 10 to 20% of our administrations I think may well be to residents of other counties. And that's just a factor that we have to bake into the process. And the state's looking at that too. They're trying to build a database so that they can load balance the delivery and allocations as well to make sure everyone is getting an opportunity to get the vaccine.
And Jeff and Claire, can you share with us a little bit about what your providers are hearing from patients just about the vaccine itself? People are still trying to get used to this and see what any side effects others are having that have already had it. I hear a lot of questions about behavior-wise, what should you do after you have received the vaccine? And I know there's been guidance about continuing to wear masks and that kind of thing, but can you kind of get into some of the medical side of it about what y'all are advising patients on?
Sure. I'll go first, Jeff, and then you can jump
Sure.
in. I think the first thing is people are interested in the vaccine for the most part, although there still is some education about safety and why it matters that we are working to do constantly. We have, we've given over 20,000 first doses and people have handled it really well. There are some side effects. Sometimes people will talk about, not feeling great the next day, not too unlike a flu vaccine. But otherwise people are, they're doing really well. The science is still somewhat new as far as ability to still transmit. And so everybody is encouraged to still follow the same precautions that we've been following as we work through this whole process over many, many months. So we still need to do those things about wearing a mask and social distancing and hand hygiene, just like we were doing before.
I think that's exactly right. And one of the other things I might mention is, our system, and I'm sure New Hanover's and also probably David's and Chris's systems are being fairly overloaded with patients calling in with questions about the vaccine. And one of the things we would ask is, check the guidance on the state website, check the guidance on our website, check the guidance on CDC website before you make that call to your provider's office. And of course, if you have a unique situation, then please, of course, call your providers. But if it's questions about when will the vaccine be available, as you can see, even the folks on this call don't know the answers to that. And it would help. Correct me if I'm wrong. I don't want to speak for the others, but it would help all of our systems be able to continue to provide services more efficiently if the folks out there that have questions could check the online sources first. And certainly all of us are going to let the community know as soon as we have vaccines available.
Well, here's one of those questions that you guys can knock out right now then and save some calls on a specific patient level question. But if someone has had COVID in the last 90 days, is there a recommendation about getting the vaccine now or waiting? I'm sure you guys get lots of those calls. If someone's already had COVID in the past, if they've had COVID recently, do you still get a vaccine?
I think that I'm going to hesitate to answer any medical questions because I'm not a provider. But certainly I think eventually the answer to that is yes, that they will get one. I just don't know where they'll be prioritized off the top of my head. And I think that those questions could be answered, by looking probably at the CDC website and probably some guidance from the state as well.
Yeah, I would.
Is it 90 days?
I think that's right. But again, I really try to not provide medical advice.
Yeah, I would advise the same thing, to use their resources. Talk to your provider if you've got a question. CDC puts out information out there on that, and people are encouraged to still get a vaccine, even if you've had COVID in the past. Again, the science is still being worked out about whether that needs to be right at 90 days or before that. So I would also encourage you to look at the CDC's recommendations on that and talk to your provider. I'm also not a physician or provider, so I don't want to give any direct information, but yes, people are still getting vaccinated if you've had COVID in the past.
And we'll be sure to include the links to those sources then, to the expert sources in the article we post with the video this afternoon. So again, on the science then, talking more about that, Wall Street Journal today had a story this morning about vaccinations and skeptics of vaccines, but also just talking about whether we can get to herd immunity or not. So can you guys explain just a little bit about that in terms of, if folks aren't as familiar, about what is the end goal? We're talking, I know, in the day-to-day logistics and weeds of vaccines and how it's going to get rolled out, but what is the ultimate goal with this program nationally?
I'll give the general answer, which is if enough people are vaccinated, then the virus is not still spreading. I think that's what we're getting towards. That's what we are aiming for with herd immunity. Specific numbers, I will turn that over to somebody who's more expert than I am in that, but that's really what we're aiming for. If enough people are vaccinated in the community, then the virus is not able to keep spreading.
Yeah, in general, what we hear is 70 to 80% of the population somehow in some manner inoculated against the virus. Whether that's a recent contraction of the virus and having built up antibodies and immunity, in addition to all that's vaccinated, in addition to all of the preventive measures, all these preventive measures in terms of distancing and face coverings and hygiene, surface cleaning, are all about interrupting the transmission. So that works in combination with the vaccine and everything else as well. So, but herd immunity is really, it depends on the virus also and the ease of transmission. So there's no one number, and we'll never know exactly when we reach that number in terms of percent of the population. As the society opens up, we have many travelers in and out of the country. So that's a very hard mark to know when we hit on any given day or week. But it is certainly a good 3/4 of the population being immunized, so that even if there is some transmission, it gets interrupted pretty quickly. So it doesn't have a long chain of transmission.
And David, another question for you. Cris mentioned that they were using Odell Auditorium, and New Hanover Regional, I know, has used the empty movie, or the still closed movie theater at the point. I shouldn't say empty, because I would assume at one point they're going to show movies there again. But for now, since it's not being used, it's been a clinic site. Is the county making plans already, or getting ready for when those future groups start to get opened up to use any other large facilities in the area? I think our reader had some examples, such as like some of the vacant parking lots, gyms, high schools, things like that.
Right, we have those plans in our hip pocket, so to speak. Our locations, we have a nice building here at Health and Human Services. We're using a large multi-purpose room there that's working out pretty well, in addition to our Senior Resource Center, which are with a pretty large space. So our throughput capacity is right around 1,000 a day. If we're maxing out those two locations, we're also utilizing the MLK Center down on 8th Street, which is a great location to access a variety of diversity of communities. So large locations that we've used in the past, for instance, last year and the year before, we used the large parking lot at CFCC campus to do flu vaccination. We have a plan for that. We have a plan for other locations, the Veterans Park location that we have used and exercised in the past in the northern part of the county as well. It's really a matter of how quickly the supply goes up overall and how quickly that supply gets diversified to providers. Because if we have 100 providers in the greater Cape Fear area vaccinating, we may or may not need huge mass sites. It really depends a lot on that and how that plan rolls out. And that is part of the long-term plan. As you can see, the Walgreens at the federal level and providers, a lot of providers are enrolling. It's just a matter of getting enough supply to start sending them supply. And the other barrier consideration is how these are shipped. As you know, Pfizer has shipped in 975 dose packages for good reason, to keep it stable and viable. And even the Moderna is shipped in 100 dose packages. So even a small practice maybe wouldn't want 100 at a time, because you have to get through that in a certain amount of time. A large practice such as Jeff with Wilmington Health and large practice networks are able to handle that easily. So that's part of the logic as to how this is rolling out.
You know, I think this is a great opportunity for us to really talk about it from a community perspective, because, you know, just as New Hanover has, and just as David and his team has, I'm sure Cris as well, you know, we have our eye, and our facilities team and ops teams have done a great job at identifying other locations around town. We've had active conversations with a number of landlords and have these contingent sites ready to go if and when the supply materializes, and to the extent that the other providers in town are still not able to access that supply. But I think that, you know, perhaps we could take it offline, but a conversation between Wilmington Health, the hospital, and the counties about what our collective thoughts are. So to make sure that we all are putting our best foot forward to, and not stepping on each other's feet, to vaccinate the county. It's a tremendous opportunity for collaboration amongst all of the providers. I think we ought to take that opportunity.
Agreed.
Yeah, I agree as well. And even, you know, even other members of our community, you know,
No
we're all in this together has been the saying this year, but it's true too for the vaccine program. You know, we've got students volunteering, you know, different locations like you've talked about. This is really a huge community thing. So I absolutely agree. The more that we can all be collaborating together, the better.
And on that note, and just to kind of wrap us up for the half hour, one thing I did want to ask each of you as we leave is to kind of put something out there. What is something you think that we could do, or you guys as organizations can do, or even the state can do to help out in terms of making the next weeks or months roll out even smoother as you go through this process? Is there anything that comes to mind that you think would be most helpful in this program?
I'll take a quick shot at it. I think there's probably, you know, 2 or 3 things. One, from the state perspective, find a way to get the vaccines in the most trusted hands of healthcare providers, as many as possible. Number 2, continue to educate the public on, you know, the value of the vaccine, and find ways to reach out to the underserved and those affected disproportionately by the COVID virus. And number 3, collaboration across all of the healthcare providers in the community, because this is a community effort, and this is the community's vaccine, and we're entrusted to deliver it as efficiently, as quickly as we possibly can, and that's what we need to do.
All right, great. Well, I want to thank all of you for spending your lunch hour with us, and thank you for sharing all this information. I thank all of you for watching and for submitting your questions, which have been very helpful as well. You can watch a recap of the video, of course, on our Facebook page, but in our afternoon email at 4 o'clock with those links that I was talking about. And if you joined in late, we'll also have this on our new podcast channels, which are available on Apple Podcasts and Spotify. And we will be looking for new topics and issues and people to talk with around town. So feel free to email those suggestions to newsroom@wilmingtonbiz.com. We'll keep an eye on that, and we will meet you back here at noon next Thursday for another installment. Thank you very much.
Thank you.
Thank you, everyone.